Hi all, good afternoon. My name is Adira Kumar. I am working as a lecturer in Psychiatry department in Bliss College of Nursing, Bangalore. Today I am starting a new journey in YouTube. So my channel name is Adira Tutorials. If you like my channel, please subscribe and give a like button for me. And today I am going to take a small topic from psychiatry, that is mini mental status examination. So when we are coming to the mini mental status examination, the total time which is allocated for doing this mini mental status examination is 15 minutes, and the score we are giving for that mini mental status examination is 30 score, that is a total score of MMSC. And this is mainly we are doing to assess any cognitive impairment of the patient. So what was the main aim of doing this mini mental status examination is to assess any cognitive impairment of the patient. Okay, so this mini mental status examination is having major 5 categories. Under that, first one is orientation. So when we are doing this orientation, if the patient was correctly oriented or if he is properly oriented, we can give 10 points for the patient. And again in this orientation, it was again divided into time as well as place, which means if the patient is properly oriented to the time, we can give 5 marks, and if the patient is properly oriented to the place, we can give 5 marks. So how we can able to assess whether the patient is properly oriented to time as well as place? So we can ask some questions to the patient regarding time as well as place. Suppose, or I will say some examples as like from where you are coming and what time you had your breakfast in morning. So when you are leaving from here, so like that we can ask different questions to the patient, that is 5 different questions regarding time as well as place to the patient, and the patient can able to properly answer for these 10 questions, we can give 10 points for the patient. So that is the first part, that is orientation. Then coming to the second part, that is registration. In registration, what the examiner is going to do means the examiner can show 3 different objects to the patient. Here I have taken scissors, then pen as well as scale. And if the patient is properly naming these 3 objects, we can give 3 marks for the patient. So that is registration. That is, normally we can consider registration and recall, that is togetherly. If the registration is okay and we can able to assess the recall of the patient after some time, that is how we are doing means you just ask the patient that we have shown some objects before, can you able to name that objects, whatever we have shown it before. If the patient is telling that correct object's name, we can give points for the recall. For that recall also we can give 3 marks for the patient. Then coming to the next part, that is a third category, that is attention and calculation. So here for assessing the attention and calculation, we have to give some mathematical calculation for the patient. Suppose, as like I will say some examples, make the patient to, you just give a calculation like that, subtract 7 from 100. That is subsequently or consequently the patient has to subtract 7 from 100. Which means 100 minus 7, 93, 93 minus 7, 86, 86 minus 7, 79, like that, 77, like that the patient has to consequently subtract the numbers. If the patient is properly doing, we can give score for that patient, for that attention and calculation. So that score is 5 marks for that attention as well as calculation. And coming to the last part, that is language. In this language, we have to give 9 marks for the patient. That is, again the language was again divided into naming, writing, reading, repetition, command as well as copying. So like that again we need to assess. For assessing the naming, you can tell to your patient that name any 2 things or any objects. If the patient is properly naming, we can give 2 marks for the patient. Then next one is repetition. In repetition, I will say one example. You have to say one proverb to the patient. That means all glitters are not gold. Like that you will be saying one proverb to the patient. That's what's the thing we have to keep in our mind, means only one time the examiner has to say that proverb. If the patient is properly properly having that proper language, the patient will be repeating that proverb same to us. Okay, so that is repetition. The next one is reading. In reading, we have to give on a piece of paper which is having some content, and if the patient is properly reading, we can give 1 mark for that reading component. The next one is writing. In writing, give a piece of paper as well as a pen, and the patient is having the full freedom to write whatever in that paper. And what's the thing is, when we are assessing that sentence, it should be a meaningful one. If that sentence is a meaningful one, we can give 1 mark for the patient. Next one is commanding. For commanding, the score is 3. So in commanding, what we are supposed to assess means, or what we should do means, we will be commanding the patient. Such as, I will say one example, take a piece of paper. So we will be giving one piece of paper for the patient, and I am telling to the patient that you just fold that paper. After that I am telling again you just fold. That is 2 folds again you will be doing, you have to do. So like that, if I am instructing the patient and the patient can able to follow my instructions or commands, we can give 3 marks for that commanding part. And the last one is copying. In copying, what we should do means, I can give any diagrams for the patient, and the patient has to see that diagram, and in another paper the patient has to copy that diagram. So that is called as copying. For that copying also we can give 1 mark. So that much regarding mini mental status examination. So we have seen that the total score is 30, and the total duration of doing this mini mental status examination is 15 minutes, and in that we are mainly focusing on 5 categories, that is orientation, registration, recall, attention and calculation, as well as language. I hope everyone understood this topic. Thank you.